do this like 10, 12 hours a day, it's catching up. So
the hard work of hunting down COVID-19. This is the InsideEdition.com coronavirus news from May 27th, 2020. A public health investigator admits that tracking the coronavirus can be emotionally exhausting.
It's nice to get those positive reactions from people that are very grateful that they do see, the purpose of what we're doing and trying to, protect the community and stuff.
Maria works as a contact tracer. Contact tracers try to figure out where and how the virus spreads by talking to people in the community. Her work helps researchers figure out the sources of infection.
I'm just following up on your COVID-19 test results. Do you have a couple minutes? Perfect. So I'm sure you're aware, but your test results did come back positive. Have the hospital informed you of that? They had it? Okay, yeah, so they did come back positive.
The information contact tracers gather can be crucial to keeping people safe, as Chicago Mayor Lori Lightfoot recently noted.
One of the most important weapons that we have in this fight is contact tracing, which is our ability to follow the path of this disease in order to learn where it's coming from, who's getting it, and how it's spreading in our communities.
Contact tracers need to be detectives, nurses, social workers, and data scientists all in one.
I don't think that people realize the amount of work that goes into someone doing this work.
I get people that lie all the time. I try to get as much information from the beginning, but it's just not always the case.
The science-driven work of fighting COVID-19 still has hurdles. A recent AP poll found that only 49% of Americans said they would get a COVID-19 vaccine. 31% said they weren't sure, and 20% said they'd refuse.
It means that there's still uncertainty around the side effects of a potential vaccine, about whether or not there's a lot of myth about vaccines and whether or not they might get coronavirus from taking the vaccine.
One poll respondent voiced her concerns.
To get a COVID-19 vaccine within a year or two causes me to fear that it won't be widely tested as to side effects.
The head of the National Institutes of Health said those fears are misplaced.
I would not want people to think that we're cutting corners, because that would be a big mistake. I think this is an effort to try to achieve efficiencies, but not to sacrifice rigor.
But more will need to be done to convince the skeptic that a coronavirus vaccine will be safe.
I think there's an opportunity for the policymakers and health communicators to convey kind of what's going into building this vaccine, how solid are the data to make sure that it's safe, so that when it's available, we can kind of have pre-addressed some of those concerns.
For one Texas dad, a COVID-19 vaccine cannot come soon enough.
And as a father who takes care of his family, I think, it's important for me to get vaccinated as soon as it's available to better protect my family.
Now, Inside Edition's Ann Mercogliano reports on another pandemic so many people have seemed to have forgotten.
Did you know there was a previous pandemic in our lifetime? The year was 1968. Soldiers returning from Vietnam brought home the Hong Kong flu. The similarities to our current plight are striking. A total of 100,000 people lost their lives to the Hong Kong flu in America alone. We're now nearing the same sad milestone today with COVID-19. Some of the most powerful people in the world have been hit with COVID-19, and it has penetrated the president's inner circle.
My fellow Americans.
In 1968, the Hong Kong flu struck President Lyndon Johnson. He'd said it was the worst he ever felt in his life. Famed NASA astronaut Frank Borman was also stricken as he orbited the moon on Apollo 8.
God bless all of you on the good earth.
But there are major differences between the two pandemics. During this crisis, we get constant updates on our smartphones and from 24-hour news sources. Back then, it was mostly limited to daily papers and network evening newscasts. Information did not flow as quickly as it does today.
People weren't aware back then that it was a pandemic.
Jim Poling was hit with the Hong Kong flu when he was 25 and living in New York City. Then, as now, the city was the epicenter of the pandemic in America. He wrote a book about it called Killer Flu.
It's the sickest I've ever been in my life. I thought I was going to die, and I was young.
Today, we are in lockdown. Businesses are shuttered. Stadiums are empty. Unemployment is at historic highs. Having now lived through his second worldwide pandemic, Jim Poling says he knows one thing for sure.
This is going to happen again.
Right now, there are more than 5.6 million confirmed cases of COVID-19 and more than 350,000 deaths worldwide. There are nearly 100,000 deaths here in the United States alone. For more on the novel coronavirus pandemic, visit InsideEdition.com.